Um, Hi everyone, good evening and welcome to Nivarna's Public Health Forum. For those of you who are hearing about Nivarna for the first time, Nivarna is a public health information and advocacy platform which was started in 2022. We aim to bridge the gap between the public and public health by making complex information accessible and easy to understand. We wish to empower people with the right information, and we hope that more people will begin to be bothered about public health practices in the country, that they would understand what is lacking, and ultimately they would demand that things change. So, Public Health Forum is one of our initiatives, and in this, we will have solution oriented discussions of problems with experts on a panel in front of an audience. So, I am Dr. Christianis. I'm the deputy editor of Nivarna, and I'm also an internal medicine physician. I'm working in Guwahati, and I will be moderating this session today. So let's move on to introducing our panelists. First, we have Dr. Sebin. Dr. Sebin is an extremely academically gifted consultant pediatrician who has won awards for being the best postgraduate resident during his studies. He works in the Department of Community Health and is involved in clinical research and outreach work. He has worked in several hospitals in various states like Tamil Nadu, Odisha, and Assam. Dr. Sebin is keenly interested in health equity, in social determinants of health, and public health aspects of child health. Next, we have Mrs. Sonali Kochar. Sonali Kochar is an early childhood educator. She started teaching after her postgraduate studies in early childhood care and education. For the past 7 years, she has been dedicated to teaching and continuously improving her practices. She firmly believes in the transformative power of early childhood education on a child's holistic development. Next, we have Ms. Kritika Amin Premnath. She is a senior occupational therapist. She specializes in mental health and psychosocial rehabilitation. She has been working for the past 8 years with children and adolescents on the spectrum, and people with ODD and various behavioral issues at an interdisciplinary rehabilitation hospital in Bangalore. She also closely works with parents of children on the spectrum as a liaison between the kid and the parent and the school. She too is a gold medalist in the mental health field and has many publications in international journals. Finally, we have Mr. Pradeep Jayatilak. Mr. Pradeep is the father of a 26-year-old autistic boy. His experience of being a parent to a child with autism encouraged him to begin many ventures to help people on the autistic spectrum. In 2019, he created an assisted residential center to benefit parents looking for lifelong care for their child. So this was autism specific and was set up in 2020. It caters to around 13 adults on the spectrum. He also has a day activity center which was set up in 2022. And now in collaboration with Developmental Pediatrics Department and CMC Vellore, he also trains people um, to become autism care providers. So let's begin this discussion. The reason why we're talking about autism and autism spectrum disorders today is that a rough prevalence of children with autism in India is about 1 in 60 to 1 in 100 children, which shows that it's much more common than we know. These children deserve not just to get diagnosis and treatment, but also they deserve to get good education as a means of developing skills. They have to become independent and also progress vocationally. So, but in 2018, when a study was done to see how many children were registered and how many children were retained in school, they found that among children with special needs, only 12% of children eventually finish school education at class 12. This means that we're not doing a good job at keeping our children with special needs and autism adequately prepared for their independent life. So, this is what we're going to discuss today. We're going to talk about barriers to diagnosis and care, and also to education that children with autism face, and how we're going to bridge them on individual level as well as on a level of policy. So my first question is directed to Dr. Sebin. So As a pediatrician, can you spend a few moments explaining to the audience what autism spectrum disorder means and what are the conditions under the purview of this umbrella term?
Sorry, I went off. I think my connection was a bit
Yeah,
unstable.
so we just
I
wanted
heard
you
the
to.
last bit you were asking to mention about autism. Yeah. So I would start off, but I would like to request other panelists to contribute, especially Mr. Pradeep and others also to contribute uh, so that others who are attending this panel discussion. Autism primarily finds it difficult to communicate with others and also to finds it difficult to relate to others around him or her. So to just put it simply, when a child starts speaking, it's a matter of joy for everybody in the family. But children with autism often the speech is the issue that is noticed initially. So child may not be even making an eye contact with the parent, may not be smiling, maybe preferring to spend a lot of time with himself or herself rather than playing with other children. And you may often see that the child is doing a pretend play, so may pick up a cup and hold it over the ear, pretending to be a telephone. So this imagination, imaginative play, the pretend play, and the non-verbal communication as well as the verbal communication may be affected. And also they may have many of them may have sensory issues. So when I say sensory issues, I mean some of them may seek sensation, whereas some of them may find sensory inputs too distressing. So some children may find that when they are in an environment which is quite noisy, they are finding it quite stressful. And also some of the children with autism may have difficulty adapting to changes. So when there is a change in the schedule, they find it quite stressful. So they may be okay with a rigid schedule, but when there's a slight change in the schedule, that may be quite stressful for them. So it's not to say that everybody with autism will have all of this, or that all of them will have it in a certain percentages. That is why it is called as found in varying amounts in all of these children. And to put it simply, once again, it is something that affects the child's communication and the way the child relates to those who are around him or her. So I would request others also to pitch in so that this becomes clearer.
Okay, thanks for that. I'll give my inputs on this. To all those who are participating, I'm not driving, I'm in a car, so I'm pretty safe to talk. So if somebody's got a concern. First of all, I've seen the world through the lens of a parent of an autistic child. And now for the last 4 years, as I was introduced, have been dealing with other autistic people on the spectrum, older children and also younger ones. Now, besides the medical definition of what autism is a developmental disorder which does not allow an individual to lead a life like you and I can. And as Dr. Seben has explained, there's a lot of difficulties. But the issue is that if you're an autistic person and if you're living in an environment like in India, there isn't too much of understanding of what autism is. B, there isn't much infrastructure in terms of how to educate them, how to get them into employment. But the exciting part is that India, as it's been with other parts of technological growth, catches up with the rest of the world very quickly. So a lot of organizations are talking about inclusion. But in my opinion, once you're determined to be in the autistic spectrum, there has to be a lot of adaptations from the outside world rather than an autistic person adapting to the outside world. And that is a major challenge for people living with the condition. So because it's a spectrum disorder as well, very often autism seems to be defined based on a high functioning or person on the higher end of abilities. But that's not where the bulk of autism lies. Bulk of autism lies between moderate to severe, and like a bell curve, it's right in the middle. And that definition is very difficult to understand. We hear from movies about abilities of an autistic person, but that's only a minor part of it. But the bulk of autistic people find it difficult to navigate through normal life like you and I can.
Thank you so much, Seven and Pradeep sir, for telling us about what is autism and what are the disorders in the autistic spectrum. Now let's ask Sonali. As an early childhood educator, can you please explain why it's essential for children with autism to access education that is tailored to their needs? What are the differences between conventional and inclusive education, and why is it important for children with autism to have education that's, specifically tailored to them?
So yeah, so sure. So like Dr. Sebin and Mr. Pradeep are sharing that the needs are different and they're not leading the life like the regular typical people they do. So definitely they need education which cater to their needs. We need a education which we would say which is meaningful for them, relevant for them. Otherwise, if we are going to give them a curriculum which is one size fits for all, it is sheer wastage of their time. We are not helping them reach their potentials by catering to their needs. Instead, we are creating further problems to them. We are, one, wasting their time. We are, I would say, increasing their social emotional needs because they get hard time in understanding what is happening with them, uh, to understand something which is not at all important and which is not going to help them much at that moment. So, one is catering to their needs is really important. And what you asked about conventional and non-conventional schools. So yeah, so conventional schools are those we would, so we can go back to the, the time before this policy where the inclusion was not there happening. So conventional schools did not give the opportunity to the children with disabilities to be the part of the mainstream program. And conventional schools, here the teacher would come up with one syllabus, with one curriculum, one teaching practice for the all the children sitting in her classroom. So if they're 30, 25, 40, doesn't matter. We have one curriculum, we have one teaching strategy, and by the end of term, they all need to pass, whether you get 98 or whether you get 33. So you all need to at least pass or you repeat the session. So this was the conventional approach. Now coming to the non-conventional, the progressive schools, the inclusive schools. Here, the ideal definition to is, because why I'm using the word ideal, because uh, in this approach also we have a long way to go. We need improvements here as well. But the ideal definition says that let's give opportunity to everybody sitting, and the children with, despite of their social emotional gaps, about their children with disabilities and the typical children, everybody sitting together and they all should be benefited. So this is what the approach says. So yeah.
So I remember in one of our initial meetings, you had mentioned that you teach rhyming words or something to everyone. And autistic children, they don't really need to learn rhyming words. So they're like confused as to why they're being taught this. So is there like things in conventional education that don't need to be taught or are particularly distressing for children with autism?
So here, as I was saying, that here we need to work on the inclusive settings also, because right now where I am working and wherever I have taught so far, these are the schools which are following progressive approach. So we have the inclusion happening here, but then again here we need to work on how to improve it. So when I shared about this example that they were being taught something which was not relevant for the child. Here again, there was one teacher and there were many children, and when the teacher is there and she has to the inclusion says that you need to prepare as per the needs of all the children. Now let's just reflect, how is it possible to prepare a lesson as per the needs of 25 children, or even if we make a smaller groups, how is it possible to create differentiated, at least 4 to 5 differentiated plans? And So again, we need to reflect on how to make inclusion possible. So when I shared about that time, absolutely those 20 minutes was waste of time for the child with a disability sitting in the class. We could have made use of that time or by doing the things which is important, but then the inclusion also says that you should involve the child in the things you're doing in the class. Otherwise, if a therapist is coming and the intervention is given to the child absolutely outside the homeroom space, then how is the inclusion actually happening? So in the in later maybe I can also explain about the challenges we face with the inclusive inclusion and what are the solutions.
Thank you so much for that point. I also read somewhere that being subjected to this conventional education system also affects the mental health of the child, because they tend to develop an inferiority complex a little early on when they're taught things that they don't need, or this. Um, yeah, so let's move on to Kritika. I wanted to ask you that as an occupational therapist who works with many children on the spectrum, do you notice that some of them have strengths that they tend to possess? Like, I wanted to know if you have any success stories of children who have done well given the right guidance and support.
Sure. So, as Sonali is also telling, for kids with, neurodiversity, we need to look into their strengths, their abilities, tap into that, and, channelize that in the right way to facilitate, and holistic growth for them. So, children with on the spectrum, they have exceptional talents, and it's just that you need to identify them at the right time and involve the parents in that too, to cater to those strengths and abilities. They have great abilities. Some kids, are very detail oriented, creative. They have, being hyper focused, pattern recognition. So there are many such talents. So I remember, one of the kids, one child, when she came in, at the age of, I think, so 2.5 to 3 years. Uh, at the time she came, we realized that yes, she was inclined somewhere to music. So along with various sensory issues, she had the specific issue where she used to keep tapping her fingers on various objects, and at the same time, humming on, but in a melodious tune. And so, as part of a therapeutic intervention, we introduced the Casio to her, and we taught her playing on the Casio, understanding that yes, somewhere she is musically inclined. And this process went on, and now she's around 8 years of age, but she sings beautifully a range of bhajans, Bollywood music. So at that point of time, we could identify that her ability is in music, and discuss it with the parents and develop that skill. At the same time, another child came in where we realized she was extremely creative. She used to do beautiful artwork, and she also exhibited, really nice dancing skills. And we sat the parents down and we told them, why don't she was attending school, she was attending a regular school. But we told why don't you channelize this strength into making training her into something as a classical dancer, because she's really good in that. And the parents understood that, and they gave her the appropriate training. And now when they come back, they tell that she is a Bharatanatyam dancer, classically trained, and she's taking part in various school competitions at the district level too. So it's really great to understand that yes, these children have maybe different needs, but they at the same time they have exceptional abilities. So there are many stories as this what I've seen through the years. So answering to your question, definitely we can help them tap on these skills to lead a more fulfilling life.
So next question I would like to ask Mr. Pradeep. So, as a parent of an autistic child, I want to know what is your story of finding out your child's diagnosis, and I also want to know what kind of education your child received, and if you had any issues trying to provide formal education, and if you could also mention a little bit about where your child receive this education?
Yeah, so Sharan was diagnosed when he was 18 months old, which back then in the year 2000 was considered pretty early to be diagnosed. And we were in a very fortunate situation because I used to work for a multinational, and I requested them to post me abroad. So they moved me to the UK, and Sharan was 4 years at that time. Prior to that, we were in Calcutta for a couple of years after the diagnosis, and it was very painful. There weren't any special schools, leave alone inclusive schools, and the normal advice that is given to parents who have had a new diagnosis: do speech, do OT. So we were running pillar to post between speech and OT, each in different parts of Calcutta. Very tough. There was a school which took him on, which was an inclusive school, and that helped him, I suppose. But we couldn't figure that out. But we moved to the UK when he was 4, and the system in the UK is very different. It's probably not relevant for our conversation, but I think what we can, as a process, learn from the system is there is an evaluation of the child's ability by the government agency, and they decide what level of school to go to. So Sharan went to a special school, but not of mixed disabilities, but a specific autism unit. And compare that to what's going on in India right now. The numbers that are coming through today, 1 in 60, 1 in 50, are borne out by CMC and the data that we have available. And literally, parents are given a bit of hope at that point. Like all parents, we go through a period of frustration, of stress. Why me? All of that. And then we suddenly get charged. Oh, I want to cure this. I want to transform my child's life. And we push on. And the first hurdle comes when the child is 5 or 6, when schools start rejecting. And very often, within a year or 2 years of being in school and the behaviors start exhibiting themselves, that's when you get thrown out. And that's ever so common in every child that I see in our day center as well. Sir, my child was going to this school and now we can't continue there. That is one. Second is, I think one of the major differences between countries is in the UK, there is a curriculum for special needs, and it follows the same educational time scale movement by age. So if you're of age 8, you're in year 3. Now, their level of curriculum, they have the same subjects, math, English, social science, but their abilities are judged differently, and their criteria is different. So there is no discrimination in that sense. So if you are seeking employment as a young adult, if you are autistic, you've been through school. You can't say, unlike in India, saying, oh, I've not been through school because I don't have the opportunity. So that's been my experience so far. And I think there are more and more government schools which are playing a very important role. I've seen some pioneering work happening in Pondicherry. I've seen some work happening in other cities in Tamil Nadu, where government schools are stepping up the game. And every district has a chief education officer, and they are motivated to do good for the special community. And I think there is also equal benefit in our children not going to exclusive school, go to Anganwadis and go to government schools. I think the judgmental element of being of special needs, having special needs, is not there in those kind of setups.
Thank you so much for your point of view. From here, bouncing off of your points, I can tell that in the UK there is a system, and that system ensures that they're not missing the diagnosis, and to ensure that every child with autism is receiving good education, and also education that translates to employment, and education that will lead them to be independent adults in the future, something that is somewhat lacking in India. So, bouncing off of this, I would like to ask Sebin, considering that you are currently working in a place which is an underserved part of the country, Can you mention a few things about children with autism that come to seek care from you? Especially rural children, is their access to care or options different um, as compared to children from an urban location or as compared to children with more privilege?
Yeah, so I take off from where Mr. Pradeep had mentioned about his son Sharon being diagnosed at 18 months of age. And as he mentioned, actually, it is quite early for a child to be diagnosed at 18 months of age because mostly children will be diagnosed later because of various reasons. One reason may be because parents may not be aware of features of autism, or it may be because they are not ready to accept accept that the child has a special need yet, or yet again because of lack of training in professionals who are supposed to diagnose this, that can also lead to a delay in the diagnosis. So again, one more point that he had mentioned, that he had to go to one place for speech and then another place for occupational therapy. So this is what happens in most places actually. The integrated approach to a child with special needs is lacking in many places, and hence parents, family will end up going to multiple centers for occupational therapy, physiotherapy, psychologist, speech therapy, developmental pediatrician. So there are centers where these healthcare providers, healthcare professionals are available under the same umbrella, but their numbers are quite low, rare, quite less, quite low and quite rare. So even uh, the other important factor to remember here is that the parent-centered therapy is not practiced in many of the centers where children with autism or special needs will be going. So the child may be taught some exercises by the therapist while the child is at the center. But then the parent, if he or she is not able to see and understand what is going on, to replicate the same thing at home may not be feasible. And to bring a child multiple times in a week or in a month, the hospital or to the center also may not be feasible. And you are asking regarding the rural urban divide. Certainly, there is a divide. So there is a lack of trained professionals who are available. And also, I would say that sometimes myths may be causing the delay in diagnosis. So, for example, I had mentioned in the introduction part that there is a problem with communication in children with autism. So, when the child does not start speaking at the time when the child is expected to start speaking, often family may justify saying that okay, he's a boy, boys tend to speak later than girls, or it may be that his father spoke only when he was 4 years of age, so maybe he'll also speak later. So there are these myths also that we need to bust, and also there is a lot of stigma as well. So when I try talking to parents initially when they come to OPD, I don't try to put a label on the child, even if the child may be showing features of autism. I tell them, see, the child is normally expected to start speaking by this age, but child is not speaking yet. So that is a matter of concern. So that is something that we need to get checked out. Not to say that definitely your child has a problem, but this is something that we need to address here. So the stigma also definitely has, I mean, is a major barrier in children being diagnosed early and getting intervention early is what I would say. And coming to lack of uh, awareness regarding features of autism, as well as lack of awareness about the ill effects of cell phone. So many studies have shown that screen time and autism have a significant correlation. Not to say that just the screen time alone causes autism. There is no one cause to say that this is the reason why this child has autism. But there is definitely a lot of correlation between screen time and autism. And I often see infants sitting in OPD or ward on the phone, glued to the phone, and parents are sometimes not aware of the fact that, not sometimes actually, I would say many times not aware of the fact that this actually has an ill effect on the child. So actually the recommendation is not to have any screen time for a child who is less than 2 years of age, and even beyond 2 years of age there are age specific criteria as to how many hours the child should be having exposure to screen time, and parent being present there, supervised screen time, etc. So I think these are some of the factors that we need to address.
So one other question I want to ask you is that it appears that, like, you have to take the child for treatment multiple times in a week and such, so that it also seems like it's designed for people of a certain socioeconomic status, because not anyone can leave their work and take the child multiple times a week. So is that also something you see, people from lower socioeconomic strata being unable to cope up with the treatment requirements?
Yes, so definitely loss of wages becomes an issue then. So they may not be able to take off from work for so long because it may be often hand to mouth existence. So that's why I was talking about parent-centered therapy earlier. So when a child is being taken to a center where occupational therapist, speech therapist, psychologist, a pediatrician will be seeing the child, the person who is seeing the child, the professional who is seeing the child, definitely need to make an assessment of what the child's needs are, abilities are, and need to communicate it clearly to the parent, and also train the parent and strengthen the parent, equip the parent so that the parent is able to take it on from there. So the family should be actually the center of the treatment, not that the family is kept at the periphery and is told that your child has a problem and you have to bring this many times a week or this many times a month, but rather it is about enabling them to take care of the child and enabling them to set the goals for next, what the treatment can be and what the child's next step can be, because it is not a static thing. So as the child makes gains with therapy, the goals will change. The goal setting has to be done according to what the child is gaining with therapy. So like you mentioned, it is currently the way it is. It is not accessible to people from rural areas. It is not accessible to people from mid or low socioeconomic status because of loss of wages, etc. So I would say that family-centered therapy or parent-centered therapy will be definitely a major breakthrough in this. And here I would also like to invite Mr. Pradeep to share his views on what he had mentioned earlier during our discussion as an autism therapist. He had talked about the possibility of having autism therapists in our country. So I would invite him to share his views on that.
So thanks for that. So my observation on this rural-urban divide or the difference. I live in a rural setup, and I have parents from both the semi-urban. Vellore is a small town, and also from the rural part where my residential facility is. And there is certainly a difference in how special needs, learning disabilities are viewed in urban and in rural. So typically what happens in a rural setup is you can say they don't go for diagnosis, they don't have awareness. But I think they take a different approach in life. They take a very practical approach. And they don't let them put the child through a forced system of learning. They just let them learn naturally. So they're running around in the village, doing what they want. The entire village supports them. So in a way, that setup is more inclusive than in an urban setup. We have to fight with our neighbor to seek their understanding as to why my child is loud. But in a rural setup, traffic stops. I was talking to one of my colleagues today, and exactly this is what happens. Uh, the development of an autistic person in a rural setup without any of these inputs that we're talking about is quite significantly different. So maybe that is one of the reasons why we don't see a whole lot of autism diagnosis in rural areas. That is one. In terms of the Sebin, can you repeat?
You had mentioned
Question that you wanted me
regarding
to
the
answer?
possibility of having an autism therapist.
Correct, autism therapist. Correct.
Yeah.
So my understanding is, being a parent as well. One of the early things that we did, which really set us on this path to be mentally able to deal with autism, was the course that we attended, run by Mary Barua, one of the pioneers in the field in parent involvement. And we attended a 3-day workshop in Delhi. We were in Agra those days, and that set us on the right path. Now, typically, when I am now in the field of autism, trying to start a day center and so on and so forth, doctors tell the parents go seek speech therapy or OT. But when I look to hire an occupational therapist, or when I look to hire a speech therapist, special needs is only one part of their entire program or curriculum. So what I think the world needs, and more so in India because of the numbers, train people specifically in autism, which includes a bit of occupational therapies, input, and the
Is there an audio issue?
I seem to be.
I think you're having an audio issue.
Till the audio issue gets sorted, I would just like to add on certain points that Dr. Sebin and Mr. Pradeep were telling. But I add on points in terms of therapy has come a long way. I mean, the therapy that was in 2001 and therapy that is in 2024 is very different. And here we are inclined towards, more of a parent-centered approach. Because see, to be very honest, to be very practical, realistic, the kids are going to be with us 1.5 hours, maybe twice a week, thrice a week. And the rest of the time, they're going to be at their home. They're going to be with their parents, with their extended family. So, understanding, training the parents, making them understand what are their sensory needs, how to have a calming environment at home, maybe a calming corner in their room, as well as, how to make them independent, because kids with autism, they require assistance in their daily living activities, which is one of the major thing which, differentiates them from the neurotypical children. At the age of 2.5, 3 years, the neurotypical child, he learns potty training. I mean, he's potty trained. You don't have to really sit and teach him. But in children with autism, that is not the case. They lag behind in all their daily living activities and all. So here, definitely, the family, the parents are going to be the major role. And coming also to Mr. Pradeep talking about, curriculum and as a therapist, what we have, we as an occupational therapist, we have like almost stipulated hours of time that we focus only on sensory integration. Modulation of the sensory system in kids with autism is the major role of an occupational therapist. So, we are, trained in that aspect only. So I just want to put in highlight, like, therapy has come a long way from the 2000s to 2024. And, understanding, how important it is to have the family and the parent uh, at the center in the therapeutic approach. Just wanted to add on.
That's a really nice point, and thank you for highlighting that that some progress has been made in the realm of therapy. Let's just go back to Mr. Pradeep also, because he was making a point before he was interrupted. Sir, are you ready to continue?
Yeah, so I don't know why I dropped off, but I was saying about the autism therapy. The question was about autism therapist. So my hope and wish is that we could combine or create therapists who are special educators, who are a bit of occupational therapists, a bit of speech therapy, all rolled into one. And that will help serve the community much better.
So, like it
That
was a
that was
very
my
nice
point.
counterpoint, a nice counterpoint that you made about children in rural areas maybe being better off into getting integrated in society as compared to children in urban areas. That was really insightful. The other thing I wanted to ask you is about your work with developmental pediatrics. Is are you working towards training people to be these autism therapists that um, you have mentioned?
So we made a humble start. We have started a certificate course, a 3-month course in a community college, which involves young ladies who have passed 10th standard, 12th standard, who otherwise would have gone into a life of poverty. So this community college is doing a great job in Vellore. So we teamed up with them and CMC to run a 3-month certificate course where we teach them very basics of what autism is, how to deal with behaviors, how to identify what are the typical behaviors. And that bunch of students have just graduated. I was in the graduation ceremony today. So we are hoping to make a difference in the Vellore community with this semi-skilled people, because nothing like experience to develop yourself as a field. You've seen one autistic person, you've seen only one, and you need to see 100 because all of them are different. And so hoping in 5 years' time, 10 years' time, we'll be able to change the landscape for families in Vellore.
So, next question I would like to direct to Sebin. And this one is about one of the discussions we were having earlier about the lack of prevalence studies. How do you think that impacts the landscape of autism care?
Yeah. So yeah. Before I begin, I would just like to say that I'd like to thank Dr. Srinivasa Raghavan. He's an associate professor at the Developmental Pediatrics Unit in CMC Vellore, and as a preparation for the panel discussion, I talked to him, and then there are a few points that he highlighted. So this is one of the points that he also strongly felt about, that there is a lack of uh, studies highlighting the prevalence. So in the beginning, I think you had mentioned that the prevalence in India may be varying somewhere between 1 in 60 to 1 in 100. But uh, those studies have not been inclusive of all areas, all regions within the country. But that is the best that we have right now. So we have to rely on that till we have something better. So we definitely need to have studies which include all areas, and also not just cities, but also smaller towns, villages, to get an idea of. So multi-centric studies is what we need to have an idea of what is the prevalence. So the issue is that some screening tools which were there earlier were not very easy to administer, but at the same time, right now there are screening tools which are available, which can be administered by people who have school level education. It does not take a trained healthcare professional to administer this. It requires some amount of orientation towards what the screening questionnaires are. So, for example, there is something called the 23Q questionnaire, and there are other questionnaires. So, in India, there is the Rashtriya Bal Swasthya Karyagram. So, RBSK has developed a questionnaire which can be administered at the community level. So, we do need these things, because without having data on how prevalent autism is, it cannot be easy to frame policies, cannot be easy to frame educational policies, as well as policies regarding how these children can be helped once they step into adulthood, etc. So that is definitely a need of the hour. Not to say that there are no studies, but we definitely need more studies on this.
Uh, I also wanted to ask you whether Dr. Srinivasa's any other points we want to bring out at this point? Like,
Okay, yeah. So there were a few more points that he mentioned. So one he mentioned was about the quality of barriers in quality of care. So I think Sonali had also mentioned earlier about the inclusivity. So, and she mentioned about the practical difficulties in implementing it. So often this inclusivity gets limited to paper. There are actually guidelines on how to make it inclusive, and now there are people who argue that instead of an inclusive approach, we should have an individualized approach when it comes to education. So, but even when it comes to the inclusivity, there are barriers. For example, the number of special educators who are available are quite less. So this is again something that he pointed out, that while the SSA has provision for special educators, the number of posts that are available is not meeting the need of number of children with special needs. So that is something that needs to be looked at. Even while I was reading, I realized that there is actually a B.Ed program which focuses on children with special needs, but there are few takers for that. So these are also problems which will be there, because when we need to have support teachers, we need to have people who are trained for that. So there definitely is a lacuna here which needs to be filled, and that's when we are talking about SSA and the government sector. So now we look at the private sector, there is a problem with the affordability issue. So how many of these schools which are inclusive or trying to be inclusive are affordable for somebody who's not from a upper middle class or from elite background, and are the manpower needs, are the manpower requirements there also enough to meet the needs of these children who are there. So these are certainly things that need to be addressed, but I think before that, the awareness that this is an important issue. It's not a very rare disorder, that it is quite common, and we are probably going to see more and more of this in the coming years is needed.
The prevalence study might help with the awareness about like letting people know that it's quite common also.
Yes, yes.
So I just want to ask Sonali, now jumping off of Sebin's point, about the practical difficulties in implementing inclusive education, especially on a large scale, if it's quite common, and then we have to implement it both in urban as well as in rural areas through various levels of resource plenty to resource limitations. So, what do you think are the practical difficulties for doing so?
So, Krishnan, it's like Dr. Sebin has covered a lot. He has shared about the lack of trained teachers. But before that, even if we talk just about inclusion, that now the school says that we include all the children, right? So there is this inclusive, the child with disability there in our school. Now we also need to see, I'll be specifically talking about settings where we are dealing with the children in early years. So a 3-year old, a 4-year old. We also need to see, is the child ready to be in the mainstream program? Are we so are we including the child for the sake, one, of the policy, second, parents wants it, schools, there is a protocol which the school needs to follow, or is the child also actually be ready to be with the other children? Because other children which are who are also very young, they are also 3 years old, right? They also have their young, they have their needs, they also cannot express their needs in words properly. So so if we say children with autism specifically, they take time in developing their social needs, right? So they do not have it, they will have difficult time in tolerating the other peers around them. So, and the other children who are also very young, they don't know why that particular child is behaving like this. So is that child ready? We need to take care of the age readiness, developmentally how ready the child is. Now, here my question is from Kritika. That Kritika, should we first, when the child is, we have the children with disabilities, they're depending upon the severity of the spectrum. Can we first give them the intervention and then bring them to the mainstream program? Or inclusion says that yes, the child needs to be there and they all need to be catered together.
Sure. So yes, according to the RT and all, it is that. That is what they state. But to be very honest, practically it doesn't work that. Doesn't work in that way. The child has to be ready to enter a school. So there are many times we first have to, address, give them interventions to, modulate their systems, and then tell them, okay, now at this level they are ready. So many of the kids that, come to us, we don't say that, okay, you're 3-year-old, you have to enter into a school, because their issues will be a lot. For example, now a child who has a the auditory system dysfunction where he cannot tolerate loud noises. Now, if you put that child in a batch of 20 kids of 3-year age, they are definitely going to shout around. There's going to be so much of environmental stimuli, and that is just overstimulating the child and not you know uh, giving the any point of putting the child into a school. So definitely first we need to see if the child is ready to get into the mainstream, get into a school, and then gradually that transition from a therapy to a school setup should be done. That is what I feel is extremely important.
Right. So I think here we need in the implementation part, here we need to keep in mind that firstly, when there is a child, before uh, involving the child in the mainstream program, the child should be ready to take it. Otherwise, the child won't be able to benefit, uh, but the child other needs can also be hampered. So this is the one thing. Now, let's suppose the child has got the intervention or the child is ready to be in the class. Let's assume this. Here, the teacher training takes place. The teacher should know the sensitivity, that the awareness how to plan. Like Dr. Sabin said, the time is to plan individually. So here, if I have to give the individual attention to the child, the teacher student ratio needs to be taken care of. So we need to have the ideal situation. What has worked with me so far is 4 to 5 children, not more than that at a time. It is not possible to cater to 25 children at once, or even if we have two teachers there in the earlier setup, then also 12 or 15 number is also a lot. There also the quality of teaching and learning hampers. So this is the second thing. Third, parent, special educators, the teachers, and the curriculum, we all need to be aligned. There needs to be a healthy collaboration between us, between all the stakeholders. None of us can work in isolation. This is what we all are trying to say, that children spend less time with us, some time with the special educators, and most of the time they're at their place. So we all need to speak one language and we all need to follow one direction that will help the child, that will benefit the child the most. This is the second thing. Third thing, rather than the special educator taking the child out for the therapies, for the intervention, if the special educator can be in the homeroom, can be in the classroom along with us, so there the child will be in the space where they feel belonged. One. Second, the special educator will get to know what teacher is trying to do. So her therapies and her interventions are not happening again in the different direction. Somewhere we are finding a balance. We together we are going in one way. So that can be taken care of. Uh, Also, the school should be ready infrastructure wise. Also, we need to be accessible. The school needs to be accessible. There should be for the in the regular setting we take care of. Okay, we should be having a playground, infirmary, and the co-scholastic setups for to cater to the needs of all the children. Now it's the time we need to have occupational therapists there in the system. We should be having the speech therapist there in the system, so that the parents also do not struggle after school. The parents, they don't have to go for the other therapies after that. Again, coming back to how much they'll spend, how much time they're investing after schools. Also, if they're taking the children to the interventions apart from the school hours, it is too much for the parents also, and for the young child also, to build relations to so many adults. Otherwise the child is having hard time in communicating the needs, bringing the getting the social relationships, making the social relationships. And now we are putting too much pressure on the child to have a connect with two teachers in the class, with the interventionist, then apart from school where the child is going for the therapy, and then wherever the child would go, there would be the other setup of there'd be different children also in different groups. So these things we can take care of.
So, this thing that you pointed out about the stress of a child to make multiple adult relationships, I feel like that could also be sorted out with Pradeep sir's idea of an autism therapist. So it'll put one individual who they can trust for all their therapy needs. The other question I wanted to ask is infrastructure and capacity building is what I think you have mentioned specifically that we need. Do you know any government schools which have this kind of infrastructure and have these kind of trained people? So that's one part of my question. The second part of my question is, how well trained is an average government school teacher to handle a child with special needs? And if they have to be trained further to be, better equipped to take care of, say, autistic children or children with special needs, what course should they do? How long is that course? How accessible it is to them? Um, if you can elaborate on that.
So, Christianis, I'm not really aware of the schools. So, the schools I have visited so far, the government schools, I have not seen a a holistic setup there for the children with disabilities. And also, I have either seen the schools which are working with the children with disabilities in isolation. So there are only those special schools, or in the government schools, there is this miss. And also, the teachers there are still struggling to meet the needs of the regular children only. They are still finding out which approach we need to follow. We are continuously changing our approach from, like, from conventional education to now play based approach, Montessori approach. We have Regimelia. There are multiple approaches which are going on, and we are, teachers are struggling with that. So there, the onus lies on the special educators to take care of the children with disabilities. So I've not seen a holistic or a collaborative system happening there. And there are courses which are there. I've in the B.Ed program, which the teachers they do there, it again it lacks of, we would say, sensitization and awareness of children with disabilities. Therefore we have dedicated courses. I think Kritika can best tell about this thing. We have the specialized courses also. uh, but then again, when we talk about inclusion, they're the training of the main teacher who is there with the child. Because I would, again and again go back to the inclusion part, where we are trying that the child is in the classroom trying to, trying to get the most benefit out of that setup from the same teacher, and intervention in the special educators coming in the classroom supporting the teachers and the child. So guiding the teachers there, like how you can teach the child with that particular needs, so she can give that awareness, and together they can make the plans, the individual plans for the child. So somewhere that we need to find. I'm not too sure about how it is happening in the other schools, so that is why I'm not, like, very confident answering that.
Okay. So, thank you for that answer. Um, let's move on and ask Kritika about policy. So we know that in 2009, Right to Education Act came into force, and that said that children from 6 to 14 years of age were eligible for free and compulsory education in government setups. Now, that did not include any children with special needs at that point. In 2022, there was an amendment, and that said that every government school should have one special educator for children with special needs, and that children with special needs are also come under the purview of Right to Education Act. So let's ask Kritika, what do you think the current state of implementation is? Has the policy been actually translated to fruitful results? Or if not, then what gaps do you think exist, like in the policy that we have to address?
Sure. So, see, I do not work in a school setup, but my insights are based from children who are attending the therapies as well as schools, as well as from parents who are just finding the just right school for their neurodiverse child. So my insights are from there. As of now, from those I can say the implementation is extremely poor, because one thing is seconding to what Sonali was telling, the child teacher ratio is not good at all. It's either 30s to 1, if we say the pupil to teacher ratio. So to be honest, the teachers, they're not at fault, but they're not able to handle. Now in that case, what happens, this child with autism, he's left to do whatever he wants to do. He's just at the background, he may be running around, he may be he may be stimming because of the sensory overload. So the entire purpose of sending a neurodiverse child to a school, not only for academic purpose but also for the social inclusion, is completely lost here. So as of now, the policy is out, the law is made, but there's no structure of how to do it. The practicality part is not taken into consideration at all. Where there is no teacher training, there's no adequate awareness given, even to the parents of the neurotypical child. Like, I have seen when instances when parents have come and told me, the other parent is not allowing their child to interact with my child, in the fear of they will also develop the same behaviors. So realistically speaking, that's not possible. But there is such lack of awareness in all the sectors, be it among the school authorities, the administrators, the parents. So this is not thought. This thing was not, when the policies was made, it was not thought ki how will we do it on a practical basis. So I can see the gaps. The gaps are in lack of awareness, misconceptions of children with autism, how they are, what understanding their sensory issues. People don't get that. They don't understand what is stimming. They don't understand. They do it for calming, which even you and me do it. If we are stressed, one of us will pick up a mug of coffee and have. That's our way of controlling our stress factor. But we don't understand that these kids have their own ways of controlling their sensory overload, or be it inadequate teacher training, what Sonali was telling, and the curriculum. Yes, there is no clear curriculum, and there is no clear examination system also. So the examination is the same, the system, even for the neurotypical child, even for children with these special needs. So we are not testing them on their abilities or strengths. We are just testing them on one clear system. So there is complete gaps in all these areas from where I can see.
Yeah.
So can I
Thank you so much.
add a couple of points here, Christianas?
Yes, yes, sir, please.
Yeah. So when it comes to the education system in India, I think India is a mixed economy, a capitalist and socialist economy. So the government policies are formed on the basis of socialism, which is equal opportunity for everybody, and that is where government schools come in. Now, unfortunately, the government doesn't restrict one form of economy over the other. So, as a parent, all of us want the best for our child. So, all of us are seeking and running behind this whole chaos of inclusion and so on and so forth for our children. And that is one of the primary problems with our policies. The government policies do exist. There is a structure that exists in government schools, but there is no accountability to it, and there's nobody demanding it. Ideally speaking, if ideally all of us would live in an ideal world, we should have one body which determines, based on the child's ability, what kind of education they should get. But that control doesn't exist in India, cannot exist in India at all. So then I think the only way around it is for the government.
Sir, I think your network is again glitching. Okay, so until Sir gets back, I just thought I'll add a few points.
Mandate.
Oh, okay.
Christianas, there is just one point I need to just bring. That Kritika, when she was sharing about, am I audible? Okay. So
Yeah, you're audible. Could you speak a little louder though?
yeah. So Kritika, when she was sharing about how her stories of success, when she saw the children, making difference or getting better at what they were, where they showed some strengths, right? And then we pushed them, and we tried making them meet their potentials. So here I am just reflecting that when the child is, again, the inclusion has happened, and if we are not taking care of the specific needs of the child, right? So here we are also missing on to the very vital early intervention the child can get. So at that early years, which is very, very crucial. So if the child is not being getting benefit in the classroom by the, in that setup, the inclusive setup, and in that time, if the, if you're wasting the time of the child, and at that time, if the child can get a specific rigorous intervention, which is very important, I think that is also being missed. So where again, what parents they do, that after the school hours they'll be taking the child to the other therapies. So this is what exactly happening. The parents, they know that these are the therapies we need to provide, but in school it's not being taken care of. There the child is just not getting that benefit, and here we need to take care of it. But for the parents who cannot provide it, the child is not getting that specific intervention at all then. So right.
True. So yeah, that's a valid point. Also, like adding to it, like that comes that this is where it comes in a collaborative approach, which is also a gap. There's no collaboration between the various therapists. See, a single individual autism spectrum, it's a spectrum. They have a huge, variety of issues and sensory and symptoms, everything. So one individual taking care of everything is not possible. You need an OT for their sensory system, you need a speech for their communication, you need a psychologist for their behavioral therapy, a special educator for their education. So there are these vital stakeholders. So a collaboration between all these stakeholders is essential, so that ultimately what do we want? We all want that the neurodiverse child leads a fulfilling life, feels included, that inclusion is there. That is what is the major aim for all of us. So there's a big gap in understanding having this collaborative approach.
Thank you so much for pointing that out, Sonali and Kritika.
I think Mr. Pradeep
Pradeep
is
sir,
back now.
yeah,
Yeah,
I think if he can continue.
yeah, yeah. No, so I just recap what I said. So I think in an ideal world, if all children were evaluated and then appropriately placed in suitable setups, that would be good. But otherwise, I think what the government should do, because talking about prevalence, assuming the prevalence is 1 in 60, we're reaching alarming rates at which people begin to panic. The system begins to panic. It will develop fly-by-night operators who will put up signboards which says, I'm a autism specialist. And there are
Mhm.
multiples of them coming up. It's like, if you drive around in Vellore, the town that I'm in, every fifth shop is a tea shop. Suddenly the tea business is booming. Likewise, I can promise you in the next 2 years, there's going to be therapy centers, rehab centers. And that is a dangerous part because it adds to the chaos of already a troubled state of situation that we are in. So government around the world, not only India, need to step in. There are policies. There is no doubt the government's done phenomenally well in setting up these policies. But enforcement, accountability,
Mm.
clarity are what is missing. And I think educators and experts, parents, all have a place to in the form of a good system for our special kids. And I think everybody's reflecting work together. And I think from my point of view, where I am super motivated to do good for the community of Vellore. And to that extent, if there are pillars of excellence in terms of diagnosis like CMCS, I would go fight my way into that. If there is a school law which says, I would go into there and fight saying, can we start an inclusive section of your school in certain ways? Is there any way I can help? So that I think is what we as individuals can do, but governments have a big, big, big role to play.
Okay, so thank you so much for that point. Definitely, we also are stakeholders, like as parents and colleagues of people with autism. We have to keep governments accountable to enforce the laws that they write on paper. Now, just a few points I wanted to add about the policy. If you look at that policy document, it will say every school should have one special needs educator, and with every 10 children, there should be one teacher. So for the 11th child, there has to be one other teacher, right? But issue is like they don't tell you where these people will be employed from, how they will be employed, where are they being, like what is the process of employment, whatever. Second thing is, children with special needs is a very umbrella category, right? Autism is one of those special needs. There are definitely other special needs. And for 10 people with 10 different special needs, there's going to be one teacher. So what are they going to be, like trained in? Who are they going to help the best? We don't know. The second thing is like these children could vary in ages as well. Like a 4-year-old and a 16-year-old, like if they are among that 10 people, they're going to have the same teacher. Like, is this teacher able to handle all of that? Like, so these things are not being explained in that policy document. Now, I will be sending an article on the chat box. I would like people to just look at it. So, if this was an RTE that was filed to find out how many special needs teachers are there for how many special needs children, they found out that one teacher per 150 children in Punjab, right? So you would say that around 294 special needs teachers were employed for around 44,000 children in Punjab. So that's really bad in terms of numbers. But then if you see who filed the RTI, it's even more funny. It's the Berozgar special need teachers. They are like people who are unemployed in Punjab. 2,500 special needs teachers who are unemployed filed that RTE to find out that only 249 of them were employed. So there is like need is there, supply is there. So how are we distributing it? Now, this is where good policy and good governance would be sorting out these issues. But because just that amendment was just one paragraph and it was not a well written paragraph or a detailed paragraph, or it's not even an action plan at that. So we can see that how policy is really letting us down in terms of like employment of special needs teachers. It's just there on paper, it's not really doing anything substantial. So yes, it's our job, I guess, to now ask for more accountability from the government and more clarity, as sir said. Like, what do you mean by this sentence? Like, how are you going to implement it? Like, when can we expect this implementation? A little bit more questions and a little bit more holding them accountable would really help. So, saying this, I'm so glad that we have all come together and had this brilliant and fruitful educational discussion. Um, so, um, I have a few questions in the chat box. So I will just start reading them out. Please address them if you think you can adequately answer that. Like I'm not addressing it to specific panelists. First question is by Anukriti Nigam. She's asking, when can we expect community programming and acceptance for children with autism spectrum disorders and their caregivers? I've seen for children with ASD and their caregivers in Vancouver, or having shows without strobe light effects. So she is really happy to know about the daycare center and lifelong caregiver services that Pradeep sir has talked about. Are there any roadblocks that people commonly face to develop community programming in India?
Yeah, I personally feel every child, like you have a right to educate, also has a right to worship, religion, right? So starting with places of worship, which is considered the most inclusive or kind group of people, uh, churches are out of bounds for special needs because of the noise they make. Temples are too loud for our children to go to. So I think there are multiple roadblocks simply because people don't understand how they can help a child with special needs. So as a parent, young parent, I've always come back, but it's not the case. understand so that they can help. So after that first stage of staring and looking at you very funnily as to why your child is throwing a tantrum in the middle of a public place, the next question is, sir, don't worry, I'll help you, right? So I think if people understand what needs to be done, there's a whole lot that can be done, but there are still multiple roadblocks. And what I say to that is, parents play an important role. They need to educate few people around them, the people in their street, people in their workplace, and that's how the word spreads.
Okay, so thank you for that answer. Aksa Sara Biju is asking about, is there more stigma in the rural setting than in urban areas? And parents, especially the mother, are being blamed about the child. And also, there are judgmental attitudes towards adolescent girls or boys by the society. So she wants to know any insights about how to overcome all these problems.
Yeah, so I think there is another comment in the chat box which addresses that partially. It's about how, although in urban areas there is more acceptance, more awareness, not everybody from an upper socioeconomic status may be willing to include a child in their residential area. So I don't have any data to say whether there is more stigma in rural area versus urban area, but when it comes to mother being blamed, I have seen that as a common pattern, not specifically with regards to autism though, but when a child has, say, an inherited disorder, somehow the immediate tendency is to blame the mother. It's as if mother alone contributed genes to the child. So the genes come from both father and mother. So not specifically with regards to autism, but I have seen, but that again not only in, not specific to rural areas. This is not specific to rural or urban areas. And uh, one comment in the chat box reads, I have also seen parents of children who are coming from metro cities finding it difficult to gel in their gated communities because others are not willing to accept them. So, specifically with regards to adolescents, I am not sure. Probably any of the others can answer if you have come across anything like that.
So in rural India, there is no stigma. My experience says that there's no stigma. People in rural India don't have the same ambitions and aspirations like we have in urban parts or semi-urban. I have seen typically everybody, I'm talking about deep rural areas where they have a plot of land, they live off that land, they have a motorbike, the government provides a lot for the rural areas. Electricity is free, education is free, healthcare is free, and they're very happy with that. So therefore, a child with special needs growing up in that environment is not judged in any way. The families are not judged in any way. So I'm beginning to think, I'm beginning to feel that if you have autism, especially, I think there's a better chance of you growing within that disability to a better level if you're in rural India. But that's my view. There's no data to back that.
Thank you for your insights. I have another question. It's by the same person, Aksa Sara Biju. She wants to know if anyone can explain what an autistic therapist is and what is the difference between an occupational therapist and an autistic therapist. So,
So as of now, I don't think so. There is this autism therapist, this term coined, or there's no special course for it. And the major thing is what I understand is there cannot be one individual who's having the skill base of various therapists and then delivering that to a child. Now an occupational therapist will look into the sensory needs, will look into their activities of daily living, to some extent even their vocational rehab and work, where a psychologist will use will be helpful for their behavioral management, a special educator in their education. So as such, as of now, there is nothing as an autism therapist, just being for the fact that one individual or one course, if you say that ways, cannot cater to this wide spectrum of disorder that autism is. We require different individuals with their particular expertise. That is the way forward, and the way forward is to have a collaborative approach.
Thank you.
I think the other way to look at that, Kritika, is if you look at the government policy, it says should have a special educator in every school. A special educator, by that definition, means a minimum denominator of qualification to deal with special needs. So my view on this is that if there is a autistic therapist, so-called autistic therapist, which rightly point doesn't exist, and has a combination of bits and pieces of occupational therapist, speech therapist, psychologist, special education rolled into one, I think that is a better place to be to address the mass needs of what autism requires right now. Of course, specialist will become a super specialist to address niche requirements. That's my point of view.
But realistically speaking, that is really difficult because
Oh,
each
that's a pipe
yes,
dream for me.
yes,
I'd love
because
that.
each expert has their own expertise, and you cannot
Correct.
combine, you cannot take pieces of a puzzle and just join it together and say, okay, here it is. Because each professional has their own expertise, their own things, their own insights to bring it onto the table. So having this one single person, to me, it's my opinion is I don't think so. That's the way forward in this scenario.
Okay.
So
Okay.
I would just try to draw a parallel there. So like we have family physicians now. So family physicians are taking care of basic needs at a secondary or a primary hospital, or it can be even at a tertiary hospital. And then they may be able to provide guidance. They may be able to provide the initial level of treatment and to help the family to understand what the issue is. And then, if needed, and if possible, they may be able to refer that person to a specialist for further evaluation or further specialized care. So I get what you're saying about how each therapist or each person brings their own strengths, and I agree with you. Like in an ideal world, yeah, probably that is what we will definitely benefit from. But right now, you and I both know the gap that is existing between the needs. So like how a family
Um,
definitely in identifying children with autism and those the multidisciplinary team definitely that as well.
Sabin, is your network okay? Yeah, so I think Sabin's stuck. So until he comes back, I'll just take one more question in the interest of time. We try to be very punctual with Nirvana, and this has been such a fruitful discussion. So, for Mr. Pradeep, as a parent of a neurodiverse child, would you prefer your child to be in the mainstream school from early on, or is it acceptable to keep him or her in a special setting initially, especially considering that the child has been newly diagnosed? If
Yeah. So when it came to Sharan, I think we were very fortunate, as I mentioned earlier. We had the luxury of going through a course run by Mary in Action for Autism in Delhi, and that gave us a very clear idea of where Sharan was on the spectrum, and therefore my need was a special school for him. I think society judges you based on where your child goes to school, and a lot of parents want to hide the disabilities. So that's a challenge on its own. But I think depending on where you are on the autistic spectrum, an inclusive school might be suitable for some. But in my case, it was definitely a focused autism unit that was required.
Thank you. Thank you so much for sharing your experience. It was really brilliant to have all of you here. So, my one line summary of this forum discussion is that autism spectrum disorders are quite prevalent in India. And though we don't have the prevalence studies to state what is exactly the landscape of autism, we do know that they are quite prevalent in India. And children with autism are quite underserved, especially if they come from um, rural areas or from marginalized communities or from lower socioeconomic strata. We do have policy that tells them that they have a right to education, but we do not have good implementation of, and we need a lot of uh, accountability from the government in order to ensure that the policy is implemented in um, towards all its potential. We talked a bit about inclusive education. We talked a bit about how whether an autism therapist or a course of autism therapy could solve the issue of you know um, autism care in India. And we also talked a bit about societal acceptance, what are the prevalent myths, and we eventually come to this conclusion that as parents, as colleagues, and as healthcare professionals of various capacities, um, we have the way forward where we can ask for these changes, not just from the government, but at our own levels. And that children with autism need to be integrated into the society. They need to have an independent life. They need to have a means to have good vocational skills. And it's truly important that, considering it is a disorder with a high prevalence, that we focus on these measures at various levels to ensure that they are not excluded from their basic rights like right to education and employment. I would like to thank everybody for being here, especially the panelists for being here and giving your insights, and also for Parth and Nivarna for hosting this discussion. Thank you so much. And there are a few questions that we have not addressed. So you can just put those in an email. We will ensure to connect you with the panelists that it's addressed to, and we will ensure that your question is answered. And thank you so much, and have a good night, everybody.
Christina, since Saknik had raised, I think, 2-3 times in the comment box, I think Mr. Pradeep has already answered it in one line that autism is not a childhood disorder, but it's a lifelong condition that needs help. So I'm also just highlighting that, and also coming back to the point with what Mr. Pradeep had mentioned earlier, that soon autism specialists will be coming up in various corners, or probably they're already coming up, and there will be cures. There will be actually, even when you Google autism, one of the results which come up is cure for autism. So there are people who offer things like stem cell transplantation, etc., claiming that autism can be cured. But as he has rightly pointed out, it is not something that gradually resolves with age. So since he has flagged the question 2-3 times, I thought we should address it.
Yeah, definitely. Thank you so much for highlighting that point, Sebin.
Thank you.
And thanks everyone for joining in. I right now we'll conclude the session, and then hope you have a good night.